So welcome along to another episode of the Business of Hearing podcast. And today's guest is one of those rare humans who managed to walk two very different paths, medicine and tech, and somehow managed to make a dent in both. So Dr. Edmund Farrar is a co-founder of a company called Otto, a digital platform transforming how tinnitus is managed and how hearing care professionals can better support patients dealing with it. So this conversation isn't just going to be about tinnitus or tech. It's about what happens when innovation almost meets empathy. So we'll dive into Edmund's journey, why he left medicine, how Otto is helping modern hearing care practices grow, and maybe what the future of hearing healthcare may look like. And just because we couldn't resist, even though we're tackling the big stuff, we may even point to the fact we're both British, spending a lot of time in the US. So we may debate whether American bars are better than British pubs, if pancakes deserve to be called breakfast, and the age-old tea versus coffee debate. So whether you're a practice owner looking to stay ahead of the curve, or you're here for the English breakfast tea versus pumpkin spiced debate, we'll have a lot of fun in this conversation, and I appreciate you being here. But Edmund, I suppose best place to kick this off. For those who don't know who you are, what's the backstory?
Well, thanks for having me, Ollie. Really excited to be here. As you mentioned, I'm a medical doctor by training. I graduated medical school in 2015. And in my last year of medical school, joined the military, joined the Air Force in the UK. The plan for me was I wanted to train as a surgeon. I was dead set on going in surgery, specifically plastic surgery. So I kind of went down that path. But during my time training as a doctor, and I did 2 years of surgical training as well, two things happened. The first was that I saw lots of patients with a condition called tinnitus. Of course, your listeners will know a lot about tinnitus. And I saw how difficult it was for these patients to get access to good quality help. And this was in the military as well. The military in the UK is usually very good at looking after people with healthcare. The second thing that happened was I actually got tinnitus myself. And these two things kind of gave me this realization, actually, okay, there's this big problem. People with tinnitus don't get access to the help they need. And this kind of coincided with I'd come to a kind of a pause point in my surgical training, and I thought, I'm not enjoying training too much. Do I really want to dedicate the rest of my life to this? I've always wanted to start a business. So I got together with my co-founder, George, and my other co-founder, Jamil. George is a doctor in the Navy, or was a doctor in the Navy. Jamil, an ENT in the UK. And George and I thought, let's just take a crazy risk. Let's quit our jobs, quit the military, and let's try and work on this problem.
So I got to ask, what was your parents' reaction to this? So when you've trained to go to school, you're training to become a surgeon, a medical doctor,
Yeah.
and like, no, we're going to do a
Yeah.
tech startup. That must have been a fun conversation.
Yeah, so let's just say they lost some hairs in that time. Look, my dad's a teacher, my mum's a nurse. Come from a kind of very standard like middle class background. But my parents worked very hard to get me to help get me where I am today, and I'm extremely grateful for that. And I worked very hard at school to get into medicine, worked very hard to get into the military, plastic surgery, extremely competitive. And then just one day I was like, I'm not going to do this. I'm going to take a risk. But my parents were, of course, it was stressful for them. It's stressful for me. It was stressful for my partner. But it's they just said, you want to. It's important you're doing what makes you happy. And doing something in the tinnitus space, in the audiology space, does make me happy. It's something I feel extremely passionate about. And of course, helping veterans as well is something means something very close to my heart.
Beautiful. And tell us a bit about Otto. Like, what was the initial vision of it? On day dot when it first started. Give us a bit of understanding of what you were looking to build and the journey that you've been on since.
Yeah, we undenied for a few weeks, few months about whether to build a product for both hearing loss and tinnitus, or just focus on tinnitus. And it wasn't until we started speaking to lots of people with tinnitus that we realized how difficult it was. The original plan hasn't really we've not really deviated too much from that. So the original plan was to build a solution that would give anyone with tinnitus instant access to CBT. So CBT, cognitive behavioral therapy, proven treatment for tinnitus. We know it's effective. There's been countless studies that demonstrate it's effective. But only 2.1% of patients with tinnitus get access to CBT. It's the same in the UK, same in the US, same in the majority of most of the world, really. So we thought, how can we put CBT into a digital program, into a digital therapeutic, and build something that would give anyone access to CBT whenever they wanted. So the first iteration of the product was, I think, 7 days of audio content that just taught some patients a bit about CBT, what it is, how it works. We tested it, we put it in front of some patients, and they paid for it. They found it really helpful. So we thought, okay, this is something we need to put more time into. We need to put more energy into, and we started building out the content. And that was about I think it was around 5 years ago now we launched the first version.
Beautiful. And I obviously this is Business of Hearing podcast, and the people that listen to this are generally practice leaders. So help us understand this from their perspective. Like, let's ignore the patient for the moment and the benefit. Anybody listening to this should know the benefit. Is from a practice owner's perspective, how would this as a solution benefit them?
Mm. So if you have an audiology practice, you will by default see a lot of patients that struggle with tinnitus if you're fitting hearing aids. The best practice guidelines, AAOHNS 2014, state that you should recommend CBT for any patient with persistent bothersome tinnitus. If you're fitting a lot of hearing aids and by default, you're going to be seeing a lot of patients with persistent bothersome tinnitus because the conditions go hand in hand. But you're probably not going to be sticking as a practice owner or an audiologist, or HRS, you're probably not going to be sticking to those guidelines because it's so hard to find a CBT specialist, a therapist in your area. So not through choice, you're not able to stick to these guidelines. Otto solves that problem for you. Otto allows you to, and I can tell you, we can come on to the research and how we've shown Otto is as effective as how we're showing Otto is as effective as one-on-one CBT. But Otto allows you to stick to best practices by delivering the CBT skills and techniques to patients without having to refer out. It's as simple as that.
Gotcha. So I suppose from a practice's perspective, and to merge this into marketing a little bit is, we speak very heavily about like finding points of difference. Naturally, why should somebody choose you over all other options available to them? Tinnitus is a unique one. I think from a marketing perspective, huge amounts of search traffic. Most practices look pretty much the same, say the same thing without any form of specificity of how they help people to achieve certain outcomes or manage certain challenges. What have you learned from that perspective of like put Otto into a practice in terms of how it attracts patients, in terms of how it retains patients? I'm just thinking like busy practice owner, another thing they could potentially offer and the confusion that can cause and the extra workload. What does that transition look like?
Well, let me just start by explaining some of the specifics of the product and how it works, and then I can tell how that looks like. So Otto is a digital therapeutic for tinnitus. It's a 3-month CBT program that the patient will do 5 to 10 minutes a day, recorded audio session, spoken voice, and it will essentially teach the patient to change their emotional response to their tinnitus, so they habituate, and the tinnitus stops having an impact on their life. Our provider solution, Otto Pro, gives the providers an access to a dashboard, which they can use to enroll patients in just a couple of clicks and also track patient progress. So one of the main challenges that practices have these days is patients, getting new patients through the doors. How do we find new patients? And actually, one of the best sources of having more patients coming through the doors consistently is referrals from physicians. Physicians want to know, are you, if I'm going to refer you for a tinnitus treatment, for tinnitus support, is what you're providing effective? Is it evidence-based? Does it provide the patients a good experience so that I can trust that when I'm referring patients to you, that patient's going to get a good clinical outcome? What is it that we know gives the patients good clinical outcomes? CBT. So one of the things that Otto will do is that it will not only just help you stand out to your patients, because you can market yourself as having a tinnitus program, not just fitting hearing aids for tinnitus patients, a tinnitus program, a structured approach to managing tinnitus, but it also helps to it helps you to stand out, and it's very attractive for physicians to send patients to you, because that physician knows that you're providing best practices in relation to the tinnitus guidelines. So it's a really great approach, and we're seeing our providers are using Otto to build a tinnitus program if they haven't set one up already, or expand their tinnitus program if they already have one. And that's increases their reputation for providers and for physicians, I should say, and patients also.
Gotcha. And give us some success stories here, right? If we pick out random practice and think of a practice owner that's listening to this and are like, oh, this is something we probably should do. Yeah, give us a bit of an understanding of what we typically see from practices that put this into place, some of the outcomes that it produces.
Yeah, so the first one I want to mention was one of our first providers that we set up, Dr. Gail Whitelaw. So Gail is one of the, I'm sure she won't mind me saying this, is one of the top tinnitus specialist audiologists in the States. She was one of the first Lanier providers, and she's widely regarded to be, get the best outcomes with her tinnitus patients. So Gail includes Otto by default with any of her tinnitus packages. And it allows her to provide that help that CBT provides with the emotional response aspect of tinnitus. So that can be very time consuming for providers. And you can spend a lot of time talking to the patients about and counseling the patients, how to modify that emotional response. But Gail allows Otto to do that work for her. So she's spending less time with the patients talking about the emotions. And she's saving time for her and her team. It's also an additional revenue stream. So you can use Otto to increase your prices of your existing packages, or you can use it to provide an additional package for those patients that have normal hearing, so that you would typically not really be able to provide much for. So it's increased revenue stream, saving you time, and of course those increased numbers as well. The second provider I'd like to mention is Dr. Emily McMahon, who I'm sure, again, many of your listeners will know. Widely regarded to be, one of the top tinnitus specialists in the US, extremely experienced. Just published some research with Lanier. And again, Emily uses Otto to, for those patients that are particularly struggling with the emotional side of their tinnitus, and as a result, has better outcomes. And that's regardless of whether she's using Lanier, whether she's using a hearing aid. You can use Otto to enhance the outcomes that you would have already got, because of course with a hearing aid, you have to take it out at night. So there's going to be 12 hours where the tinnitus isn't going to be managed. With Lanier, for example, it's going to take a bit of time before the treatment kicks in. So Otto can help prime patients, improving their sleep from the outset, priming towards habituation, and getting a better outcome. So yeah, two providers that have had a really good experience with Otto so far.
Beautiful. And just to change kind of direction slightly here as well is the one thing that I think is interesting about Otto is you've combined almost hearing healthcare and tech. And I think we're naturally at a very odd crossroads as humanity right now, with AI and mass job displacement and everything else, where tech is now playing a bigger role in healthcare. Zooming out of tinnitus and Otto, like, what do you think the future may look like for how tech and hearing healthcare may merge?
Well, we're going to see over the next few years some very rapid change because of the advent of artificial intelligence and large language models. Many people would see this change coming and either don't want to hear about it or feel threatened by it. But actually, I would encourage providers to look at this as an opportunity. That you can use, there's a few kind of hurdles that we'll need to cross with the regulatory side of things and make sure it's done properly and in a safe way. But AI allows an opportunity to um, streamline processes and get rid of processes that are repetitive and very manual. And you'll be able to use that AI in literally a few years to replace those processes. It could be things like triage, it could be things like admin work, it could be things like following up with patients. This is all going to change very, very quickly. And one thing I'm very confident with is that it's not going to be replacing clinicians, audiologists specifically, anytime soon, because it's a very specific, specialized role that requires a lot of training. But it will unlock potential for to provide better patient outcomes, to streamline the way you manage patients with tinnitus or whatever else. So I think we're about to, well, it's already started, but we're seeing some really, really exciting changes with the advent of AI, and there's some really exciting companies. It could be a simple thing like dictating notes instead of having to write them down. In 2 years' time, nearly all practices will be doing that. They'll be dictating notes instead of having to write them into Counselor or whatever software you use. So big opportunity, and I'm personally very excited to see what changes come of it.
I like that. Yeah, very true. And I think from my observation with AI and the levels of intelligence that are coming down the line here is that what is going to lose some element of value. It's going to be easier to access, if not already, big amounts of knowledge. But I think the thing that is never going to be replaced, which I like about this industry so much, is empathy and connection.
Yes,
Something that AI can never touch, and they are
exactly.
so rich in this industry.
Yes,
Which is exciting.
And it gives providers an opportunity to put more focus into that, because that's what's important. They can delegate the repetitive admin-based tasks and put more time into patient contact, making the patient feel happy with the treatment that they're getting, and that's, I think, a big opportunity.
So true. They can spend more time on the things they're great at and less time on the things
Yes,
they just need to do in order to be great.
exactly.
So
Yeah,
it should.
yeah.
So I said at the beginning of this, given the fact we're both in the UK, or we're both from the UK, and we spend a lot of time, whether mental energy or physical presence in the US, I've got 10 questions for you about a UK to US preference, and I just need the answer, and I'm intrigued. So we're
Yeah,
ready
far
to go.
away.
It's going to be a quick fire round. All right, number one, an American bar or a British pub.
Oh, no debate, British pub.
Number two, a Sunday roast or a barbecue rib.
Well, I live in Spain at the moment, and they do great barbecue ribs, but I'm still going to have to go with roast because it just every time I go home, I have a roast. So yeah, 2 out of
Right,
2
we'll move to
UK there.
breakfast.
Yeah.
A full English breakfast or pancakes with bacon and maple syrup.
Yeah, we're going to get. I think the most of the answers are going to be UK here. I
Right.
just don't understand how you could eat pancakes with syrup for breakfast. It's
I'm with you. I'm with you.
yeah.
There's no disagreement here.
Sorry to your listeners.
I
This is,
know.
I don't want to be like disrespectful of the culture, but for me, it's English breakfast. You can't beat it.
Dare I say the preparation on these questions has been very specific
Yeah,
from a Brit with preferences.
yeah.
All right, number four. From a sport perspective, football or football with pads?
Well, yeah. There's only one real football, um, and that is football. In football, the sport that originated in the UK. So yeah, I just, again, I don't really understand American football. I've tried to watch it, and I've got a few friends that are into it, but it's I just find it very, very confusing. I don't like how they stop every 5 minutes to show ads and things.
Agreed.
I'm
Agreed.
probably offending a lot of your listeners with this, but
Maybe, but I'm completely behind every opinion up to now.
yeah.
And I think this is the biggest contentious one: the UK office or the US
Mm.
office
Oh, the TV show. Oh,
TV show.
again, like I do like the US Office, but like you just can't, Ricky Gervais is just it's the original, It's And I think the dry, like it's a lot more depressing, I would say, but I think the humor is, dare I say it, a lot more refined
I hear you on that.
than the US humor.
From a driving perspective, tiny winding country lanes or endless straight highways.
That depends. I think if you're trying to drive to work every day, then I would go for the US roads. But I do love driving and I do love cars. If I want to go out for a drive, I don't have a car anymore, but when I did, which I loved, I would definitely go with the narrow roads. But the roads in the UK are terrible, and I live in Spain at the moment, and the roads here are a lot better. But still, there's
Agreed.
something about those narrow country lanes.
Cadbury's Dairy Milk or Hershey's?
Oh, Cadbury's.
All right, I need to give a fair question here the other
Yeah,
way. Right?
yeah,
So like a
yeah.
weekend in Las Vegas or a weekend in Blackpool?
Las Vegas.
There you go. So
Yeah,
I had to
easy.
guide it that way
Yeah,
somewhere.
yeah,
Um, oh man, that yeah, I thought just a little bit of fun that was now actually the more I look at it, the more it was clear what the answer was going to be for all of them for any Brit. But
yeah.
yeah, I think the
So
Blackpool.
the other funny thing is I talk quite fast. And obviously us having a conversation, it's no issue for you because you're used to it. But a lot of the time when I'm talking to people in the US, they have to ask me to repeat something because they've not understood my accent. And actually, I was speaking to we spoke. I told you about this before, but I was speaking to a provider a few months ago, and they said, "Oh, I listened to your podcast," and I thought, I don't do a podcast. He said, "Yeah, there's a British guy that does a podcast about audiology." Um, and it turned out they were talking about you, and I don't know if your listeners can tell, but I would say we have very different accents,
Agreed.
and this they'd obviously confuse the two.
Yeah, I always find that interesting, right? Like we had our kind of client meetup recently. A bunch of our members came over
Mm,
to the UK, and our team who were there, our staff, range from heavily Welsh through to heavy
mm,
Yorkshire, through to Manchester accent, through to the thickest Brummy Birmingham accent, and
mm.
there's like a lack of it's not seen.
Yeah,
It's almost
yeah,
like
yeah.
just it all gets rolled into one, which I always find fun.
Yeah, yeah. I think that's just kind of, it's any country really you go to, and you understanding the niche of the accents is something you just don't realize happens until you go there and you spend time talking to people there.
Absolutely.
Mm.
Well, man, no, I appreciate your time. Appreciate you joining. Appreciate you giving kind of your backstory. The fun of having to have that awkward conversation with your parents, and then what it's gone on to produce, and the work that you're doing to help many practices, to help more people, to help helpers help. Yeah, it's beautiful to watch. And if somebody's listened to this and they want to find out more about Otto and the work that you do, where would they go?
Yeah, so you can go to our website, joinotto.com, JOIN Otto.com. Please, if anyone's interested in talking to me, you can send me an email. Very happy to jump on a call and tell you more about Otto and how we could help. My email address is ed at joinotto, JOINOTO.com. So if you just Google Otto tinnitus, it'll be the first one that comes up. But yeah, Ollie, thank you for having me. Really appreciate it. Big fan of the podcast, and yeah, I've enjoyed the conversation. So thank you.
Excellent. No, I appreciate your time, and yeah, we'll put the link in the show notes as well. So if you're watching this or listening to this in the description, you'll be able to go and find out more about Otto and find how you can get in contact with Edmund. But no, I appreciate your time, buddy, and yeah, I'm sure we'll catch up again soon.
Thanks. Take care.